In the session we just completed about treating the patient rather than the disease, we talk about how the healthcare system is poised for tremendous transformation. If we look back 150 years to the days of healthcare that were dominated by nursing defined by Florence Nightingale, where the nurse really took care of the vast majority of patient needs, it was a simpler time. We knew much less about healthcare, and as a result of that, one person could take care of the vast majority of needs for a patient and treat them very holistically. Since then, our knowledge and understanding of healthcare has deepened tremendously through innovation and persistence, but also through technology. We've learned about anatomy, biology, genomics, physiology that has enabled us to be able to do so many more things than we used to, and that's been enabled through technology. But with that has come tremendous complexity. Back in Florence Nightingale days, again, perhaps one person could treat a patient for a vast majority of their needs. Today, if you look at the typical patient in a hospital stay, they'll be treated by 50 plus people over the course of 24 hours. So why has that happened? Technology is so complicated and the flows of information and data are too much for any one individual to absorb. We had to create specialists and subspecialists to be able to absorb that information and continue to dig deeper into those areas of study. But now we're at the precipice where technology could fundamentally simplify and transform the way healthcare is delivered by bringing in advanced sensor technology, augmented intelligence, and other exponential-driven capabilities that will enable, much like if you're a Star Trek fan and Dr. McCoy could operate this piece of equipment to scan a colleague very quickly and easily, and anybody could use that equipment. We're heading in the direction where our technology will be able to translate information for the clinician or physician so that they're not having to absorb all the different inputs, and also take advantage of the reams of data that we have available that show what's worked and what hasn't worked. And that allows us to be able to make better decisions, faster decisions in a more patient-friendly way that really then allows a clinician or physician to treat that patient rather than having to focus on their disease area of specialization. And that offers tremendous hope for how we can reduce cost and drive up the effectiveness of healthcare.